MET PIR for the quadriceps. The quadriceps is the name for a group of 4 muscles: the rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis, all of which act across the knee to extend the knee, with the rectus femoris additionally flexing the hip. If we briefly look at the attachment points for that muscle group, the rectus femoris originates at the front of the pelvis. It crosses the hip at the anterior inferior iliac spine, the AIIS. It also attaches to the femoral body, as do the other 3 quadriceps. They all attach to the femur, travelling downwards and inserting into the tibial tuberosity via the patella tendon. Vastus lateralis is at the lateral aspect of the leg, intermedius in the middle, and medialis on the inside. As we said, their main action as a group is to extend the knee, with rectus femoris also doing hip flexion. But there's also an element of medial and lateral rotation when the knee is flexed. In terms of looking at MET, we're going to work across the knee. So normal range of motion, so if we stretch the quadriceps, we should get to about 135 degrees of flexion. Sometimes though, that will be restricted if someone's quadricep group has become quite tight or quite increased in tone, and it starts to affect that range of motion. So we might see someone who gets to maybe 100, 110, and we want to increase that range, we might choose to do an MET. Even if someone has good range, we might want to do an MET to help reduce tone in the muscle itself. So let's take a look at how we would do PIR, Post Isometric Relaxation, for the quads. MET for the quads. So we're going to start with an active range of movement test. So can you just bring your heel towards your bum, please? Okay, so quite restricted through the quads here, and relax. We're then going to follow that up with a passive range of motion test. So let your leg go heavy. Let me do the work. Lovely. Just keeping an eye, so I can see already her hip is starting to lift. If I go any further, we're seeing that rotation through her back. So you need to pay attention to what's happening in the body to make sure you get a true sense of range. So really her end of range is actually around here, so quite restricted. Then we're going to find that first barrier point where we feel the tension kick in, which is around here. Watch your posture, so I've got elbow in waist. And when you're ready, just push down into my hand, meet my resistance. 10, 9, 8, 7, 6, 5, 4, 3, big deep breath in. And as you exhale, just let the leg go, let it go, lovely. Then you've got 10-second window till you feel them completely relax. And then slowly and smoothly move to the next barrier point. Hold it for 10 seconds. And again, when you're ready, kick down. That's it. 10, 9, 8, 7, 6, 5, 4, 3, big deep breath in, out, and let the leg go completely. Lovely. So again, don't rush this part. Wait until you feel the leg relax and go heavy. And then simply move to the next barrier. Okay? And hold for 10 seconds. And again, when you're ready, kick down. 10, 9, 8, 7, 6, 5, 4, 3, big deep breath in, out, and relax. Lovely. Let it go. Okay, so I can see now she's not moving through here. That feels like end of range. So I'm just going to hold that last one for 20 seconds. Just allowing the nervous system to acknowledge this new range before we complete. And then retest. So can you bring your heel towards your bum for me, please? Thank you, lovely. So still a little bit of lifting through the back, and that's why we do a passive range of test. Much better. So really important that we look at any compensatory patterns going on in the hips and spine.